If you or a loved one has been harmed or has passed away as a result of an anesthesia, intubation, or extubation error during a surgical procedure, it is possible that the patient or their family may be entitled to compensation. It is imperative to note that time limitations exist, as statute of limitations may be running out. Our esteemed law firm offers a complimentary consultation, and we urge you to contact us at your earliest convenience to discuss the merits of your case. We can be reached at 7185-319-700. Surgical procedures are associated with risks, including anesthesia-related complications. Anesthesia errors during intubation and extubation are among the most common causes of morbidity and mortality during surgical procedures. Despite advancements in anesthesia techniques, such errors still occur, leading to significant harm to patients. Let us explore the reasons why people may experience anesthesia-related complications during intubation and extubation. Causes of anesthesia-related complications during intubation. Intubation is a process where a breathing tube is inserted into the patient's airway to provide oxygen and anesthesia. Complications during intubation can occur due to various factors, including the patient's anatomy, poor visualization, operator error, and equipment failure. One study found that the most common cause of anesthesia-related complications during intubation was difficult airway anatomy, accounting for approximately 30% of all complications. Another study found that operator error was responsible for 23% of anesthesia-related complications during intubation. Operator errors may occur due to a lack of experience or training, poor communication, or fatigue. To minimize the risk of operator error during intubation, it is crucial to ensure that operators have sufficient training and experience in airway management and communication protocols. Equipment failure is another potential cause of complications during intubation. Faulty equipment, such as malfunctioning laryngoscopes or endotracheal tubes, can lead to delays in intubation or failure to secure the airway. Ensuring that equipment is well maintained and regularly checked for faults can help to reduce the risk of equipment failure during intubation. Causes of anesthesia-related complications during extubation. Extubation is the process of removing the breathing tube from the patient's airway once the surgical procedure is complete. Complications during extubation may occur due to airway obstruction, inadequate ventilation, or aspiration. One study found that the most common cause of anesthesia-related complications during extubation was airway obstruction, accounting for approximately 34% of all complications. Airway obstruction may occur due to factors such as laryngospasm, bronchospasm, or inadequate cough reflex. Inadequate ventilation can result in hypoxemia, hypercarbia, or respiratory acidosis, leading to further complications such as cardiac arrest or brain damage. Aspiration may occur if the patient regurgitates gastric contents, which can enter the lungs and cause aspiration pneumonia. To minimize the risk of complications during extubation, it is crucial to ensure that the patient is adequately prepared for extubation. This includes ensuring that the patient is fully awake, has a patent airway, and is able to breathe effectively without assistance. It is also essential to monitor the patient closely after extubation for any signs of respiratory distress or airway obstruction. Anesthesia-related complications during intubation and extubation are a significant concern for patients undergoing surgical procedures. The causes of such complications may be due to various factors, including patient anatomy, operator error, and equipment failure. To minimize the risk of complications, it is essential to ensure that operators are well trained and experienced in airway management, equipment is well maintained, and patients are adequately prepared for extubation. By implementing these measures, it is possible to reduce the risk of anesthesia-related complications and improve patient outcomes. Once again, if you or a loved one has been harmed or has passed away as a result of an anesthesia, intubation, or extubation error during a surgical procedure, it is possible that the patient or their family may be entitled to compensation. It is imperative to note that time limitations exist, as statute of limitations may be running out. You have limited time to act, so call now.